Hi, I'm Toyya Braskey from Galveston's Psychic Paranormal Researcher. I wanted to come on today and tell you that I have a surgery date for my breast reconstruction. It is August the 14th, 2025. Now, this has been a long journey all the way from January through the end of June. I had to have multiple scans, 2 biopsies, and the reason that I'm having breast reconstruction is because 40 years ago I had 2 lumpectomies, and that resulted in mastectomy implants being placed in both breasts for symmetry after the lumpectomy. So 40 years went by and I didn't have any issues. I had the same implants in my chest. And then about 6 months ago, both of those implants ruptured. So it sent me on a journey to the hospital where I had to have several scans. At that time that they did the scans, there were 3 scans. There was a breast MRI, there was a ultrasound, and a 3D mammogram. All of those tests revealed that I had multiple masses in my breast. Multiple, like bilaterally on both sides. I had probably 20 masses. Some were cysts, some were fibroids, some looked cancerous. My mother is a breast cancer survivor. So, because I had ruptured implants, multiple masses, my case was complicated. I was sent to several specialty surgery surgeons and plastic surgery to review my case. So I was presented with several options regarding breast reconstruction. Some of those were very revolting to me. I did not want to have a total mastectomy. I had 2 biopsies. Luckily, even though my mother was a breast cancer survivor, mine were non-cancerous tumors. Some were cysts and they were aspirated, but I still had multiple masses in my chest. Not only that, I had silicone in my chest because both of the implants that had ruptured were now completely flat. They were underneath my muscle, not in my breast, but they would have to come out. So I want to make it clear that I never ever wanted to have another breast surgery. This is not cosmetic surgery. This is reconstructive surgery. So this sent me on a journey back and forth to the doctor's office where I was very confused. I didn't like the scarring of a mastectomy. And then when I got to the surgeon's office, she suggested that I have a breast implant exchange plus a mastopexy, which is a breast lift. And when I saw the breast lift scars, I just hated it. To be honest with you, it looked like some kind of Frankenstein patch quilt. It looked awful. I'm going to tell you that I think that I have pretty breasts now. They're very round, they're very dense. I don't have a lot of scarring. Even after my mastectomy implants 40 years ago, I had one of the best plastic surgeons in Houston. His name was Parvez Arfai. He's now retired, but still living. He did the most wonderful incisions where I had maybe a 1-inch scar under each breast. It was so razor blade thin that you could barely see the scar. Well, maybe 1 to 2 inch scars, to be honest. But they were so razor blade thin that you could hardly even tell that I had surgery. I had a small half crescent moon scar around the nipple where they took out the lumps. But again, the surgery and the incisions were so wonderful that you could hardly tell anything had been done to my breast. And they were very pretty and very nice, and still, at the age of 61, very dense and very round, and I think that I have nice looking breasts. So the idea of having really massive scarring was very devastating to me, to know that I'm going to have to go through reconstructive surgery because of the rupture. Whether I want to have the surgery or not, I have to have it. So when they were first explaining mastopexy, which is the breast lift, they were talking to me about how they, well, let me start with first things first, they will have to remove the ruptured implant. That implant is underneath my muscle near my rib cage. It is not in my breast. So the first thing they'll have to do is cut me from side to side, pull out that implant, and then scrape out the remaining leakage of silicone. So I will already have massive scars underneath my breast. So the second thing that they were explaining to me is, well, because I'm 61 years old now, and because I have a lot of skin in my breast, this is my breast right here. They are a D to a double D cup. So when they are going to remove tissue to take out the leaking silicone and possibly the masses, it's going to take out a lot of tissue out of my breast. So they were explaining to me that we were going to use a high profile implant to put back into my breast tissue, not under the muscle, but actually in my breast, in the glandular tissue. And I totally agree with that, because what happens when you're older is you do not want an implant underneath the muscle, because here's what happens. The implant under the muscle, if you're young, will project your breast out because it's kind of like a hump underneath your muscle. But as you get older and your breasts begin to drop, if all you have is the implant underneath the muscle, then when your breasts begin to drop, your breasts are going to drop below that hump, and your nipple may be hanging kind of down and awkward with that hump. Now, I don't have the hump anymore because mine have flattened out and leaked into my chest. But I saw pictures, and they were awful, of older women who have the implant under the muscle, and then their breasts have begun to drop or to sag, which is called ptosis. And it looked miserable. It looked terrible. So if you're older, I would suggest going with the implant inside the breast, over the muscle. So I was really happy with the thought of a high profile implant, because a high profile implant is very different than the standard round implants that they had in the past. A high profile implant is more vertical. It is very projectile in a frontal way, and it is flatter on the sides so that you don't have the big fat boy breasts that stick out to the side. So you're going to have very nice projected frontal breast if you have the high profile implant. So I chose that. When they were explaining to me about the mastopexy, and they told me that they would have to cut a vertical scar up my breast from the bottom half all the way up to the nipple, cut around the nipple, move the nipple up and then sew this back up? I said, absolutely not. Absolutely not. I couldn't stand the scar. I looked at several cases and that scar just drove me crazy. It looked like something from a patch quilt, like Frankenstein stitched up. I did not like it. So I was very adamant, no, I do not want the lift. I just want the implant. And I thought, well, if they put the high profile implant, probably the implant alone will raise my nipple quite a bit. I was wrong. Now my nipple is not centered like it was when I was younger, but it's not too low. It's kind of, it's dropped a little bit. It's maybe in this position, but not down here. So I thought if I have a really full implant, that it would force my nipple to come up. That's a myth. It won't happen without the lift. So my surgeon had told me that, but of course I'm stubborn and I kept insisting I'm not going to have that lift because I hate that scar. So I left thinking that I was only going to have the ruptured implants removed in an implant exchange and I would be happy with that. But then as the months went by and I was waiting for insurance to approve my surgery, which is a reconstructive surgery, which is covered under the Women's Rights Act for reconstructive surgeries for people who have lumpectomies, mastectomy, cancer, and even non-cancerous things that are related to breast reconstruction. I began to have all of these doubts. I began to be flooded, literally flooded with worry about everything that I could possibly think of. I started to think, my mother is a breast cancer survivor. Now, right now, they have not found any cancerous lesions in my breast, but even after the biopsy, I still have multiple masses in my breast. So then I began to worry, if I just put in big implants in the glandular tissue of my breast, then that's going to make it impossible in the future for me to have needle biopsies. So then that was scary. Then I started thinking about, I'm 61 years old. If I just have a large implant put into my breast, in the breast tissue itself, over the muscle, is that implant going to pull my nipple even further down because of the weight of the implant? So then I started thinking, you know what? I bet my surgeon is correct when she told me the first time you're going to need an implant exchange and a lift. I think that she knows what she's talking about, because I don't want to have to go back a couple of years later because I insisted on being right, and then they just put the heavy implant in my breast and then my nipple turns out down here. So I began to backtrack and say, you know what, I think I've made mistakes. And so I could have had my surgery as soon as June, but I called the doctor's office and I said, you know what, I'm having a lot of doubts and confusion about the surgery and about the procedures. I'm having a lot of anxiety and fear. And I think that I need to think about this before I make a final decision. Now, I watched YouTube videos, and believe it or not, I watched a YouTube video about a RN, a registered nurse, who was a very educated person, who in 5 years had 3 breast augmentation surgeries because she could not make up her mind about the shape, about the size. And then after the 5 years, she had a um, X implant surgery where she removed the implants after the 3 surgeries. I'm not crazy like that. I mean, that's really obsessive. That's really someone who maybe should have never had the surgery in the first place. So it's very common to have anxiety. I also read that up to 70% of women have a lot of anxiety about breast reconstruction. And boy, it hit me. It hit me like a truck. It just started to worry me in every way. The complications, of bleeding risk, of anesthesia, surgery alone, how much they're cutting that they will actually have to do on my breast. It's really a lot of cutting, because by the time they cut under the muscle and fillet that side to side, then they're also going to have to cut inside my breast and around the nipples and on top of the skin. It's a lot of cutting, so there's a big bleeding risk. So I started to panic about those type of things. I could not make up my mind. I called the doctor's office, and I think that they were a little bit upset because they were ready to get me on the surgery board, and then I told them that I still feel confused. So I did have a chance to relay my concerns to my plastic surgeon. Now I'm very blessed because my plastic surgeon is the chief fellow of plastic surgery at University of Texas Medical Branch. I trust her. I really, really wanted her to do my surgery. So I have the best of the best surgeon doing my surgery. I don't feel any kind of fear with her doing the surgery. In fact, I feel so blessed to have her as my surgeon, as busy as she is. I had actually met her when I was an employee at University of Texas. I worked in cardiology. I was a heart specialist, telemetry tech, and also a specialist EKG person that worked in cardiology. And I used to see her all the time, and I would talk with her. So she was the first person that came to mind when my implants ruptured. I wanted to ask her what to do. And because I had leakage from my chest, I wasn't sure if it was breast cancer or if it was just leakage from implants. So she ended up being my saving grace, talking to me about my case. I went to see her for my first consultation. I told her that I would like her to be my reconstructive surgeon. So she is. So I'm very blessed for that. After consulting with her and telling her that I know that I'm stubborn, and from the beginning I think that I made mistakes when I didn't listen to her. I think she knows what she's talking about, being the chief fellow of plastic surgery. So I told her that I still have a lot of pain from the silicone that is leaked all in my breast, that is in my chest right now. I'm still worried about these masses that are still in my breast. And so originally I was only going to have the breast implant exchange, but I told her because of the pain in my breast with the leaking silicone and the masses, that I felt like I needed the tissue removed. And she agreed with me. So then the second thing that we talked about is I told her, you know you suggested that I have the mastopexy in the first consultation. And I'm beginning to think that you are right. I understand now, after reviewing cases, A implant alone will not raise my nipple. In fact, the heaviness of the implant could pull down my nipple. So, I'm going to agree to have the mastopexy even if I hate the scar. So, in the final consultation for my surgery scheduled August the 14th, they are going to do 3 things. I am going to have a breast implant exchange where they will remove the implant from underneath my muscle, and they will exchange it with an implant over the muscle, which is a high profile implant. They will do what's called a breast capsulectomy, which will be cutting out most of the breast tissue, which will include all silicone and some of the masses that are in my breast. So a capsulectomy, which is something I've never heard of. They will also be doing the mastopexy, which is the breast lift, which could include that vertical scar that I hate and the cut around the nipple. So, I've decided that even though I hate tattoos, I do not have a single tattoo on my body. I also researched how women cover that scar. And I found this very beautiful, very tasteful picture of a woman's breast who had the scar under here and the vertical scar going up. And she did this beautiful, very, very tiny vine of flowers or roses that were so tiny that all it covered was just that little scar. And it looked like a little vine of roses or maybe cherry blossoms that went up to the breast, to the nipple. And it looked so beautiful. It was not ugly. It was not trashy looking, like vulgar tattoos. So I said, you know what? I could probably do that and I wouldn't feel bad. So, as it stands right now, it's affirmative. I will be having a breast implant exchange, a breast capsulectomy, and a mastopexy, which is 3 different procedures. My insurance has approved it because of my health condition. So, I'm not ready, but I have to do this. And I'm just glad, like I said, my surgery team is the best of the best. I'm so lucky to be able to have the chief fellow of plastic surgery doing this surgery. I will have a recovery time of 8 weeks, but I'm looking forward to getting this done and over with. I wanted to tell you that I just bought a new ring light. If you're noticing that the clarity of my video looks a lot brighter, I'm using my actual ring light that I bought, and I'm going to do a product review probably after this video to let you know about this ring light. I really love it already. This is the first time I've ever tried it, and it feels like my video has much more clarity with a ring light. I've never even used a ring light ever before in my life. This is an 18-inch ring light. This is the first setting and only setting that I've tried so far. It has so many settings that it's a lot. So anyway, let's see. Maybe I can show you some of the settings while I'm here. So I could dim this. I can change it to different degrees. I can change the colors. I can go to colors. This is red, orange, yellow, a much lighter yellow, green, bright green, still green, really, really green. Okay, now I'm in the blue light. This is a bright, brilliant blue. This is almost a royal blue. This is a, I would say a navy blue. This is a gray tone. So as you can see, this is pink. There's so many options on this. It's really, really great. So let me go back to white light. This is actually a orange. I thought it was, okay, I'm trying to get back to the white. Well, I just bought it, so I'm not exactly sure where the white light is. Now it does have a dimmer somewhere on it. I think this is it. So I can dim the light also. Anyway, wish me the best for my surgery. As you can see, always I like to wear my bright colors. That's just my personality. I don't use any filters ever when I do videos, so what you're seeing is the real me, but today you're actually seeing me using a Ring camera. And one of the things that I wanted to say about this Ring camera is it was about $49 at Walmart. It is called the Vivitar Creative Series. I watched and I posted one review of a person who was reviewing the product, and it scared me a little bit because before I used it and set it up, she said that it came with 3 phone holders, and she said that the phone holders were trash, that they wouldn't hold up her telephone. Actually, I want to tell you that is not true. They must have improved them since she did her review, because I got 3 phone holders and they are holding up my telephone fine. They have not dropped down. They have not bent out of place. They're holding up great. The entire stand is 61 inches. It's telescoping, so you can move it up and down. It has so many colors that it's awesome. I haven't even got to really work with all the things that it can do. It has 3 areas where you can telescope it up and down. Basically, it comes with very basic instructions. So it comes with a stand that's kind of like an umbrella. I'm not gonna take it apart right now, but what I want to tell you about it is when you get it out of the box, it's about, maybe 2 foot tall, and you're gonna look for the black cap, which is on top. Make sure that that's vertical up, facing up. And then you're going to bend the legs down like this. You're going to open it like an umbrella. And then once you get the legs bent down, you're going to continue to bend them all the way down like this. So you're going to open it so that those feet that you just bent down and sideways are going to continue to go down to be the bottom of the stand. So it's super easy. So then at the top where I told you there's a black cap, you're going to take the black cap off. Then you can sit the ring light on top of that black cap, and the bottom of the ring light does have a moving mechanism that goes back and forth. So all you've got to do is untwist the screw that is on the side, and then you can position that up, down, or slanted, however you want it on the stand. I put mine straight up. So then tighten it onto the stand. So it was super easy. The telephone holders, there's 3 slots for that. They just basically have a screw on the bottom. You screw them in, and then you have 3 options to put either a camera, your cell phone, or a couple of cell phones inside the ring. It also has a charging station. It has buttons if you don't want to use the remote. It's really a great ring camera for my first ring camera. I really love it. It's 18 inches wide. It comes with a power cord that is 9 feet. The only thing that I would tell you is it's extremely lightweight, extremely. So this is not something that you want to bump because it would fall over. So it's made out of metal, like lightweight metal, aluminum, and also plastic, but it is extremely lightweight, so it's not something that you want in a room with children. If they're running through, or your pets, it would fall over. So anyway, I hope that helps you, and I just wanted to give you that update. Bye.